Thank you so much for that beautiful introduction. So, today we are going to be talking about nutrition and lifestyle changes for fertility optimization. I'm Mrs. Ejiroghene Orhewere. Currently, I'm a fertility nurse working with Bridge Clinic. I'll be speaking about a few things today about this interesting topic that I'm sure we are all going to benefit from. So, without we'll go over to the things we expect to cover today. We'll be looking at an outline that's with introduction over, and then we'll look into the growing need for fertility optimization. Factors influencing fertility optimization. We'll be looking at recommendations, conclusion, appreciation, as well as references. So let's start with the introduction. Now, to really understand the importance of this topic, we have to understand what fertility means. Fertility is the ability to conceive or have children. And when you're talking of optimization, it means that you want something to be more effective or work as efficiently as possible. So marrying the two terms together, you have that fertility optimization refers to taking steps to enhance reproductive function through nutrition, lifestyle changes, and medical interventions. The whole focus is to improve egg and sperm quality and the overall reproductive health. So the whole idea is that it applies both for natural conception rates and also for assisted reproductive technologies like IVF. So many a time people feel that, it is purely, fertility is purely biological or genetic. So my father had 10 children, I should not have problems conceiving, or my mom had 15 children. Definitely, I'm not going to have a problem with that. No, we've come to see that our food choices, our lifestyle habits day to day can actually work to improve or worsen the reproductive health. So why is this a topic of concern in the first place? That brings us to the next slide that talks about the growing need for fertility optimization. Why are we having this conversation? Now, an estimated 1 in 6 individuals of reproductive age experience infertility, according to WHO 2023. 1 in 6 individuals must have experienced infertility at some point in their lives. And so infertility affects approximately 15% of couples globally, with equal contributions from both male and female factors. So gone are the days where we feel like it's just a woman thing. This is with equal contributions from male and female factors. Sperm counts has declined by 50 to 60% over the past 40 years. That is approximately a 1.1% decline each year, showing us that it's important for us to seek help for reproductive health interventions. Women nowadays report of earlier ovarian aging due to stress, exposure to environmental toxins, poor nutrition. All of this reduces egg quality. So you hear of women in their 20s, 27, 28 years, 29 years, experiencing premature ovarian failure. So at the end of the day, we've come to see that infertility is not actually rare. It's more common than we think. It's just that at times, they are often overlooked, they are misunderstood, or maybe they are not well reported on. And why it's of concern to us is that whether it's for natural conception or IVF, it all boils down to having healthy eggs, healthy sperm, and healthy uterus. Because what I usually tell people is that IVF is a process. The doctor retrieves the egg from the woman, gets the sperm from the man, fertilizes this in the laboratory, and then transfers it to the woman's uterus. The doctors are not magicians. They will not guarantee 100% success. They just help to facilitate this process. So at the end of the day, having healthy eggs and healthy sperms is important. This does not happen in a short time, a matter of 2 weeks, 1 month. It actually takes 3 months or 90 days to be able to successfully do this. And that's why we are going to look at the critical 90 days. What does this talk about? Now, sperm cells are continuously produced. This happens continuously in the background. So it takes 90 days for the sperm cells to be produced in the testes. They get mature and they are stored in the vas deferens of the reproductive tract, ready to be able to fertilize an egg. It takes 90 days for all of this to occur, and it happens continuously. What about women? It's a bit different from the sperm. So every woman is born with about 1 to 2 million eggs in the ovaries. And as a woman gets older, the quantity of that egg gradually reduces over the years. Now, what happens is that it actually takes 90 days for these immature eggs to grow, mature, and become ready for release at ovulation. When a woman begins the menstrual cycle, this then starts to occur, and then you have these immature eggs become mature and they are ready for release. What that is trying to say is that your 30-day cycle that you're used to, for example, what that does is that it picks the egg with the highest quality and chooses that egg to be ovulated. That's what happens every month. So your 30-day cycle, what happens is that you're ovulating an egg that was already getting mature 90 days prior to that day. So it is important for us to look at these 90 days in order to have healthy sperm and healthy eggs, because factors like diet, what you put in your mouth, your lifestyle habits, smoking or taking alcohol, all of this can affect the quality of eggs during these 90 days of maturation. So we'll be looking at those things that are important or that can affect this critical 90 days of development. The first one is diet. The next one is stress. You have exercise, sleep, smoking, and environmental toxins. All of these are factors that influence fertility optimization. So let's look at diet, for example. For diet, nutrient intake directly affects egg and sperm health in that it supports DNA integrity, it supports cellular function and hormonal balance. Now, the mitochondria, which you know is the powerhouse of every cell, requires proper nutrition for it to function well, to be able to have healthy eggs and healthy sperm. Hydration, taking adequate water, about 2 to 3 liters of water every day, is also crucial because it's necessary for reproductive fluid production. So you have the cervical mucus that helps to transport the egg to meet the fertilized egg, to meet the egg. Cervical mucus, the quantity and the quality is affected by adequate hydration. It also affects the semen volume. And then when we look at toxin elimination, we know that the liver and the kidneys require adequate water intake for them to function very well and eliminate or excrete all those harmful toxins that are in the body. So we see that gone are the days where people feel eat anything you want to eat, you don't have anybody to be accountable to, enjoy yourself. You have to step back and think twice, because if you actually want to conceive and have a child, then you have to be accountable for the choices you make with regards to your food. So what are those things that we need to avoid in order to enhance your reproductive health? Processed foods. You have your fast food, burgers, fries, packaged snacks, instant noodles, processed meats, like your sausages and bacons. In fact, if you look at this picture here, it's things that people would term as enjoyment. They really look appetizing. And then you have your high sugar diet, sweets, candies, sugary drinks, sodas, fruit juices, energy drinks, white bread, and pasta. All of these have three things in common. They are high in unhealthy fats, they contain a lot of sugar, and they contain a lot of preservatives. And what happens is that these types of food can actually cause a spike in the blood sugar level. And when the blood sugar level is very high, the body naturally produces a hormone insulin in higher quantity. So a high level of insulin affects or disrupts other hormones, like your reproductive hormones. And so it causes an elevation in androgens, the male hormones, in women who have PCOS. This can worsen symptoms of PCOS, which is polycystic ovarian syndrome. And then for endometriosis, which happens to women, you find out that these high sugar diets can actually trigger inflammatory responses and worsen their symptoms. High sugar diet has also been linked to erectile dysfunction in men. So we can see how all these things are coming to play. Now, for dairy and gluten, this one doesn't apply to everybody. It applies to those who are sensitive to dairy and those who are sensitive to gluten. So you have your homemade cheese, ice cream, and flavored yogurts. So for people who are sensitive to these things, when they take dairy or gluten, it triggers inflammatory response. And then it all boils down to disrupting the hormonal balance, which affects your reproductive hormones as well. Now, excess alcohol and caffeine. Alcohol taken in excess depletes folate and your B vitamins, which are necessary for normal egg development. So when someone takes excess alcohol, it has a negative impact on your reproductive health and also the quality of the eggs being produced. And then caffeine, to taking coffee of greater than 200 milligram a day, that's about 2 teaspoons a day. Taking high quantity of coffee every day has been linked to higher risk of miscarriage and implantation failure. So we see that alcohol and caffeine, when taken in excess, can actually harm your reproductive health. For dehydration, we see that dehydration causes a reduction in blood volume. When there's a reduction in blood volume, there's reduced blood flow to your organs. And this includes your reproductive organs like the uterus and your ovaries. There's reduced blood flow to the male reproductive organs as well. And also, the follicular fluid. Eggs are get matured within the follicles. Now, the follicular fluid is mostly consists of water, and that means that when there's dehydration, it can affect the quality and the quantity of that follicular fluid. Now, the cervical mucus that we talked about, with adequate hydration, it can help to improve the quantity and quality of the cervical mucus. But when there's dehydration, this is also impaired. The semen volume is impaired, and all those harmful toxins in the body that can damage the normal sperm and egg development. If you don't take adequate water, the kidneys and the livers are not able to function properly and eliminate these toxins. So then they cause harm to one's health, including your reproductive health. So that's about it. So does this mean that we're not going to be eating things that we enjoy or things that we love? Let's look at diets that can actually be helpful in this regard. So number one on the list is folate, or your vitamin B9. What it does is that it helps to prevent DNA mutations in eggs, and it enhances sperm production. Omega-3 fatty acids is also important because it reduces inflammation and oxidative stress. Zinc is very key for spermatogenesis, and it helps to aid sperm count, motility, and morphology. It acts as an antioxidant to be able to reduce DNA fragmentation. Selenium also helps to protect the eggs and the sperm from oxidative stress. You have your vitamin D. Vitamin D helps to regulate the reproductive hormones like estrogen and testosterone to improve reproductive functioning. Coenzyme Q10, popularly known as CoQ10, helps to improve egg and energy production. Your antioxidants like vitamin C, E, and glutathione helps to protect the mitochondria from oxidative stress. Iron and magnesium is also important. Iron supports oxygen transport to the mitochondria. Magnesium aids hormonal balance. And so this is found in salmon, sardine, chia seeds. They are rich sources of omega-3. Eggs contain selenium, which is very essential. Vitamin D can be gotten from cod liver and eggs as well. For folate and iron, you can get it from your leafy greens like spinach. And then antioxidants, you see that in oranges, lemons, avocado. They are rich sources of these vitamin C and E. And antioxidants are very essential in body because they help to neutralize what we call free radicals or harmful molecules. So we don't want an imbalance. When these free radicals are higher than the antioxidants in the body, it then leads to damage to the sperm's DNA and the normal egg development. So you actually need antioxidants to help in this regard. And then sometimes you might require supplementation. Let's take vitamin D, for example. A good source of vitamin D is sunlight exposure. Imagine you go into your car, you drive to work, and then you're at work in the building all day. How much sunlight exposure can you really get? So sometimes if you feel like the dietary intake is not enough, then you can choose to supplement with supplements. You can take supplements to be able to balance this out. Of course, with your dietitian to be able to ensure that there's a proper balance. And then hydration. Hydration is important. Like I've mentioned, 2 to 3 liters of water every day can actually help. What it does is that it improves cellular function, it improves blood flow to the reproductive organs, the direct opposite of what dehydration does. That is what hydration does. It helps to maintain the quality and the quantity of the cervical mucus. It helps with sperm transport and supports follicular fluid composition. And then if you're actively trying to conceive or you're carrying out IVF treatment, it's best to completely avoid alcohol as well as caffeine. Other than that, you can limit it, but if you're actively trying to conceive, it's best to just completely avoid it during this period of time. Another thing we'll be looking at is stress, and honestly, as a Nigerian, it's very difficult to completely avoid this. Now, stress could take different forms. It could be as a result of work pressure. You have demands from your job, financial stress, long hours at work. These are things that can cause stress. What about relationship issues? Now, trying to conceive can actually cause strain on maybe marriage and relationships, and this can cause a lot of conflict. Where there's conflict, there's emotional stress. You feel this lack of support, and this can actually increase your stress levels. Emotional strain too is there, especially when you talk about the anxiety associated with the success of IVF. They are really scared and there's the fear of failure. Oh, is this going to be successful? Is this going to fail again? This can cause emotional stress. You have the physical discomfort from IVF procedures in general, the injections that you have to take, the side effects that may result from this can cause stress. Social pressure, expectation from families, from the society, from neighbors. Everybody's pressuring you on what to do. Oh, take this to be able to have a child. Or why don't you have a child now? This can cause stress. Then poor sleep pattern. Sleeping for less than 6 to 8 hours every day can actually cause stress on the body. So now, what is the effect of stress on the body and as well as your reproductive health in particular? Number one is that it causes hormonal disruption. When the body is stressed, there's an increase of the hormone called cortisol. When cortisol is elevated, it suppresses other relevant hormones like testosterone, which affects sperm production. Elevated cortisol levels also disrupts ovulation in that it affects LH and FSH levels, which are necessary reproductive hormones. So when this is affected or impaired, you then begin to think about the quality of the sperm and the egg being produced. It can result in sperm DNA damage. It can impair egg development, like we've mentioned. It reduces ovarian reserve. That means that it can accelerate ovarian aging. It also lowers progesterone and implantation rates. And for sexual functioning, stress might result in erectile dysfunction and delayed ejaculation. So these are some of the effects that it has, and we'll look at ways to counteract this subsequently in this presentation. But let's move over to exercise. Now, what exercise does is that it enhances blood flow to the reproductive organs. It reduces oxidative stress, it reduces cellular damage, it helps to regulate hormones that are necessary for fertility. It supports a healthy body mass index. Now, look at a study done in 2018 from the Journal of Reproductive Sciences. It showed that men who engaged in moderate exercise of 30 to 40 minutes 4 times per week had a 12.4% improvement in sperm motility, a 14.1% increase in sperm production, and a 17.1% improvement in morphology. So we see how essential exercise is. But moderation is key. You need to have this balance, because if you overstress in the name of, or you take on heavy or excessive exercise, you're lifting the weight of 350 kg every day, is actually going to do the opposite. Because when you overtrain, your stress levels is increased, and that's the opposite of what we are trying to achieve. So we'll go on and see those types of exercises that are actually termed as moderate exercise, which is beneficial to be sure that everything is balanced. Now let's look at sleep. Sleep helps for hormonal regulation. When we're talking about sleep, we're talking of nothing less than 6 to 8 hours of sleep every day. Why is this essential? It helps to, it affects the key reproductive hormones like your testosterone, progesterone, estrogen, FSH, and LH. These are all affected. So when the body is asleep, internally the body system is still working. The various hormones, they are still working, and these hormones, you have to be asleep for them to work effectively. So sleep deprivation actually increases oxidative stress, which can lead to sperm DNA damage, poor egg quality, and also affecting the embryo quality. Now, the role of melatonin. Melatonin is commonly known as the sleep hormone, and melatonin works to serve as an antioxidant. As an antioxidant, it helps protect the sperm and the egg from oxidative stress in order to improve their functions. Now, melatonin is produced during sleep. So if you're not sleeping well, how then can melatonin be produced, and how then will it be able to carry out its antioxidant effects on the sperm and the egg? You see how much or how important this is. And then irregular sleep schedules can disrupt the hormonal cycles, leading to poor eggs and sperm production. Let's look at another thing of importance, and that is smoking. Now, for smoking, this is not just the cigarettes alone. You have different variations. So you have shisha, you have hookah or water pipes that people smoke from. You have electronic cigarettes like vaping and all of that. So that is inclusive, because at the end of the day, they contain nicotine, they might contain carcinogens or tobacco, which is harmful to the body. So for women, what does this do? It accelerates ovarian aging. It reduces the reproductive window by 1 to 4 years, resulting in early menopause. Nicotine and toxins also disrupt normal estrogen production, which affects ovulation and menstrual regularity. It causes damage to the fallopian tubes. So the fallopian tubes have tiny hair-like structure called cilia that help in transporting the eggs. Now, smoking can cause damage to these cilia of the fallopian tubes, which increases the risk of ectopic pregnancies. Now, for men, it damages the sperm DNA. It disrupts testosterone production, which can lead to erectile dysfunction. It can cause lower libido and lower fertility rates in men. Now, the men might be smoking, but it can also affect their partners. So it can expose their partners to secondhand smoke, which increases the risk of miscarriages. That is it for smoking. We'll now be looking at environmental toxins. Now, for environmental toxins, this exposure to these toxins can be through skin absorption. It can also be through inhalation or ingestion. Taking the first one, bisphenol A or BPA, this is found in plastics and the linings of all these canned foods that are common to us. And for phthalates, phthalates can be found in personal care products like the new trend of skincare products, your hair relaxers, your lotions, skin brightening or skin lightening creams. You have to be able to check to see whether these chemicals are there, because it might be introducing environmental toxins into the body, and these harmful molecules can cause damage to healthy cells, including the egg and the sperm. What about pesticides and herbicides? As a form of pest control, farmers, spray or put pesticides and herbicides. So if you buy your food or fruits or vegetables, some of them might have these pesticides or herbicides on them. And if they are not washed properly, these toxins can be ingested into the body unknowingly. Also from contaminated water as well. Your heavy metals like mercury, lead, and cadmium, it can be found in water, can be found in certain seafoods, and also industrial exposure. Now, for air pollutants, you have vehicle emissions, industrial smoke, and cigarette smoke. These things can introduce environmental toxins into the body. Now, what are the recommendations? What can we do to be able to enhance reproductive health? No, now that we know these factors that can negatively impact it, negatively and positively impact it, what do we need to do? Now, for stress, a lot of people have reported that mindfulness, meditation, yoga, and breathing exercise helps to relax the body, helps to reduce stress levels. Acupuncture is also gaining popularity. I once had a client who was exhibiting the various symptoms and signs of anxiety disorder. So the heart palpitations were there. She was having elevated pulse rate. She's always sweating. She has jittery hands. So each time she comes for appointment, she's usually tense. And so she asked me, can I try acupuncture? And I said, fine. And she did. And I noticed the next few appointments she was coming for, she actually seemed more relaxed and less tense. Her stress levels were better balanced and normal. So eventually she got pregnant. She just delivered of twin boys early this year. So I'm not directly saying that, the acupuncture she did is what guaranteed her success. No. But we can tell that it helped to reduce the stress levels and helped to maintain the normal hormonal balance. So that can be explored too. You have social support like therapy, and that's why it's good that IVF clinics should have counseling departments to be able to help couples to speak up and talk with a healthcare provider, a counselor, so that they can help to reduce the stress levels or the psychological discomfort that these things might be causing. Journaling also helps too. Now, for sleep, you should aim for 6 to 8, 7 to 9 hours of sleep every day. For people who have interrupted sleep schedules, they need to look into this and ensure that they figure out a way to balance this out. Magnesium and herbal support. Magnesium glycinate has been seen to improve sleep. We have herbal support like ashwagandha supplements. Many people have reported that this has helped to also improve sleep levels. And avoid late night eating or taking caffeine before bed so that you can actually get the required sleep. And then the hormones that are produced during sleep can be done effectively in order to protect your sperm and your egg health. But smoking, it's important to quit smoking immediately. Quit smoking immediately. And then detoxification with antioxidants like vitamin C and E can actually help too. Also, it's not enough to just quit smoking. You also need to avoid secondhand smoking. For environmental toxins, you need to limit BPA and phthalates exposure. And so you need to switch from using plastics to using glassware in order to store foods. This might help to limit BPA and phthalate exposure. Whatever creams or lotions you might be using, you have to look very well to ensure that these chemicals are not there. If not, the body or the skin absorbs this and it goes directly into the body and causes harm. Reduce pesticide exposure. So as we can see in this picture, thoroughly wash your fruits and your vegetables in order to get rid of this chemical that might be there. For your tap water, if you suspect that the water is not clean, you need to filter this to ensure that your water is clean. Avoid harsh fragrances and harsh cleaning products. This can actually cause inhalation of these toxins. And then we are looking at exercise. Moderate exercise. Remember, I mentioned to avoid overtraining. So taking brisk walk and swimming, this can help as serve as moderate forms of exercise for the body to ensure that there is a balance. Yoga and Pilates has also been proven helpful. You can actually try that as well. So the conclusion why we are having this conversation in the first place is that modern reproductive science confirms that fertility is not just fate, it is modifiable. So while age and genetics play a role, nutrition and lifestyle choices can actively shape reproductive potential. Making these proactive choices, couples are able to not only improve their chances of conception, but they also lay foundation for a healthy pregnancy and a thriving baby. So you want your sperms to be smiling like this, your eggs to be smiling like what we have in the picture, for fertilization to take place. At the end of the day, the aim is to be able to hear that cry of the baby, to be able to pregnant. And that's what this seminar is about, being able to be proactive and make these changes for that to occur. So this is the appreciation. My gratitude goes to Bridge Clinic, especially Dr. Femi Oluwole, for her support and guidance. And I also extend my sincere appreciation to my wonderful colleagues, the Bridge Clinic staff in Port Harcourt. Also, a special thank you to the AFRH Training Committee for giving me the opportunity to share my knowledge and experience on this platform. These are my references, and thank you all for listening and being a part of this.
Thank you so much, Mrs. Ejiroghene, for such an insightful presentation. Wow. Thank you so much. We have while we were discussing, we had few questions in the question and answer chat box. And then just to let everyone know, please, if you have any question, go ahead and drop it on the question and answer chat box. Thank you very much. So we had a quick question that I think an attendee was asking, what is PCOS? Because you mentioned PCOS. I think they want to know PCOS and maybe how it relates, or how does nutrition and lifestyle maybe play a role in this. We can't hear you. You're muted.
Okay, sorry. So rightly mentioned, PCOS is polycystic ovarian syndrome, right? And it can cause anovulation in women. What happens is that there's an imbalance with the hormones. Now, diet was what I mentioned concerning that. When you talk about the diet, it increases the blood sugar level, like processed foods and high sugar diets. And when insulin is elevated, you have that the hormone, male hormone, androgen, is also elevated in women. So what that could result in is irregular periods or anovulation in women with PCOS, and this can negatively affect their health, right? I hope I've answered the question.
Yes, I think so. And there's another follow-up question still on PCOS. Akintola Olabisi wants to know what supplements are very good for PCOS.
Okay. Thank you for that question. So for PCOS, I think the overall aim is to be able to ensure that there's adequate balance of the hormones. So many a times we've seen that hormones like CoQ10 has been prescribed to be able to balance out these hormones and improve the egg quality. And immediately you also need to implement supplements that can help. So like I mentioned earlier, if you find out that your diet is not sufficient in vitamin D, you can find supplements, vitamin D supplements that can help to balance that out, as well as other supplements. But right here, I won't actively prescribe one for you to take. It will be essential to be able to follow up with your doctor and decide what specific ones that you might need with regards to PCOS.
Thank you very much, Ejiro. Dr. Akiola, are you here with us? I don't know if you have a question for Mrs. Ejiro after that wonderful presentation. We have a couple more questions. Do you have any questions, Dr. Akiola, before I go through the other questions? Can you hear us?
No. I can only, yes, I can hear you. I don't have any questions. I can commend Mrs. Ejiroghene Orhewere for taking this opportunity to give us a good overview of the importance of lifestyle modification and diet in fertility optimization. What you eat, most of the time determines your health, and fertility is not also excluded. So we thank you so much for taking your time, and we appreciate your presentation. Please, we will encourage you to write this up in a manuscript format that we can publish. It's fantastic. You may just need to do, few more research in terms of references, but it's very good. I would appreciate if you can write it. We can get somebody else that can join you to update it, upgrade it to a manuscript level. That would be fantastic. We need to engage ourselves to do more of these presentations and to write papers. We are doing a lot of work in AFRH. And please, it is also important that we show our work, our scientific prowess, and the benefits our patients are getting from all our very hard work. So I commend you and thank you so much. Over to you, Rose.
Thank you so much, Dr. Akiola. Dr. Akiola is also the chairman of the training committee and our editor-in-chief of the EJAC Journal. So please, thank you so much for your input, Dr. Akiola. So we have quite a number of questions here, Mrs. Ejiro. We have a question from an anonymous attendee, and it says, why has the fertility rate decreased in the past 40 years alone? All right. Unhealthy habits have been in existence before then. Why now?
Okay, thank you so much for that question. So 40 years ago, we can't compare the technology that was then 40 years ago to now. So as I mentioned, even till now, when I was carrying out research, there were fewer studies or research materials from Africa. So the issue might not be that these unhealthy habits were there or not there. Definitely, there's more exposure to environmental toxins as we are seeing over the years. But they were there before. Maybe these habits have gotten worse over the years. But with modern technology and science, we see that there's more reports about these things. That's why we are having like a very or more accurate understanding of how much fertility is impacting globally, right? So to answer your question simply, 40 years ago, people still had unhealthy habits, but we didn't really have technology to be able to track this. Also, these habits might have worsened over the years with the influx of technology. And so that's why you can see that it's progressively increasing, and we need to take charge of it right now to be able to avoid the number increasing beyond what it is now.
Yeah, thank you. I agree with you. And of course, with a lot of genetically modified products in the market now, which is definitely as a result of the technology, we are having to see even much more in terms of infertility. And even the IFFS, which is the International Federation of Fertility Societies, have actually, declared a war that we need to create more joy, because in another few years, we're not going to have any more babies. So we really need to create more joy, in families. Thank you for that answer. We also have an anonymous attendee asking, from your presentation, you mentioned supplements, which is great, but you didn't mention which supersedes the other. Is it natural or processed? And how long does one need to be on a good diet, I want to assume, to make impact on the reproductive organ?
All right, thank you so much. Let me start with the second part of the question first. So for how long? The early part of the presentation mentioned the critical 90 days, So for 3 months is recommended. Some people say 6 months, but for you to see like a great impact on one's health overall, and then also specifically to reproductive health, it takes about 3 months. So you can consider doing this for about 3 months, especially if you want to go into IVF treatment. You can just do this to improve your overall treatment outcome as well and aid natural conception. Now, for the early portion of the question, it says which supersedes the other, natural supplements or processed. They all have their active ingredients and what they do in the body, right? But many a times people will say natural supersedes the processed ones. So these supplements, like I've mentioned, I won't obviously prescribe here, but a better follow-up with a doctor will be able to help you decide which. But natural usually supersedes this, but you can also get supplements as well.
Yeah, thank you. And, just to follow on with another question from my end, I know my friends, they swear by IF, which is intermittent fasting. So is there a place for intermittent fasting, especially, when we are making lifestyle changes, pursuing fertility? Do you see any place in intermittent fasting to help with this?
Yes, so intermittent fasting can actually help with weight loss, but it all depends on what people term intermittent fasting. Some people go so extreme, right? And then they deprive the body of essential nutrients in the name of intermittent fasting. So one has to be very careful to follow a good dietary plan that incorporates intermittent fasting without you losing out on the essential nutrients that are necessary for reproductive health. So yes, it's a good method to explore. It's good because we've seen people who have been able to successfully lose weight through intermittent fasting, but also exercise caution. Plan this alongside with a dietitian to ensure that you're doing the right thing and you're not putting your body under undue stress or deprivation of essential nutrients.
Yeah, thank you so much. So I think we have one final question here from Anne Odokara. She says, when clients ask if there are certain foods they can eat or avoid after eating, what's your take on this?
Okay, so for this, I actually have to do my own research on the side. And when I tell them that they can eat whatever they want to eat, they should feel free to eat whatever they want to eat. But also there have been studies that show that what we popularly call zobo softens the cervix. So really there are no restrictions per se, and the person doesn't have to follow a diet that is so strict and begin to deprive themselves of other essential things. But I tell my clients to please avoid things that can cause constipation or that can lead to diarrhea. And it's peculiar to each client. So those things that may likely cause constipation, those things that can likely cause diarrhea, you need to try to avoid them. And then I also chip in the zobo there to tell them that there's still more scientific research that has to be done on this, but maybe you can avoid this in this early stage before your 2 weeks test comes up. So I think you can also tell them that as well. Don't know if anybody has any other addition to that.
Oh, wow. I'm hearing this for the very first time. So I have learned something today about hibiscus tea, which is, I think, the zobo. Yeah, that's zobo as well. Yeah. So interesting, interesting. Let's just check that we have no other questions. Okay. So we have no other questions. So we have our vice president too on this call as well. So Ms. Abiola Adeosi, I don't know if you have any comment or questions you'd like to ask our
Thank you, Rose. Thank you, Dr. Akinola. And thank you, Ejiroghene, for a wonderful presentation. I listened keenly to your submissions, and I would say I'm very, very impressed. Keep up the good work. And we've learned a lot today from your presentation. Thank you.
Yes, I have learned a lot. So thank you so much, Mrs. Ejiroghene. And just like Dr. Akinola had mentioned earlier, AFRH is trying to do a compilation of all of these topics. And hopefully we can get, the first AFRH book that encompasses all areas of fertility care, hopefully before the end of the year. I hope you'll be able to join us again when we do call you or invite you to give us more tips and tricks, especially when it has to do with, nutrition and lifestyle. So while we just confirmed that we don't have any more questions, I'll just like to use this opportunity to thank the leadership of the Association for Fertility and Reproductive Health for all that they're doing, especially in educating our members and bringing us up to speed. In that light, just to remind all of us that we will be having our conference on the 24th to 26th of September 2025. Yejide, can you put up the flyer, please, so that people can be aware? So the conference this year is in Abuja from the 24th to the 26th of September 2025. So we have our membership, the registration fees now determined, and we are currently in the process of getting live with our website. So you can just go into the website now and just look at the dates, look at the fee for our doctors, our non-doctors, our members, as the case may be. This year promises to be really, really interesting. Did I say Abuja? It is in Lagos. Sorry about that. It is in Lagos. Echo for sure. So it's the 15th annual conference. And this year's theme is New Frontiers in ART, the roadmap to the future. And we have sub-themes, interesting sub-themes, such as cutting-edge approaches to ART practice for Nigeria, innovations shaping the future of fertility care, optimizing success in ART, advances in embryology, endometrial receptivity, and implantation. You don't want to miss this year's conference. It's going to be packed full of both scientific and non-scientific activities. So please log the date. More information will be sent out via email and all of our social media platforms. If you're not also liking or you've subscribed to our channel, please, this is the time to do so. We are on Instagram, we're on LinkedIn, we're on Facebook. Yejide, can you share our socials? So yes, follow us. We're on LinkedIn. We're also on YouTube. And this presentation today will be shared live. Well, not live, recorded. The recorded version of this will be sent to our YouTube channel. So if you were unable to attend from the beginning, hopefully you can go to our YouTube channel, Association for Fertility and 1406. Please follow us, follow us, follow us. So thank you to all those that joined. You left your very, very busy schedule to join us. Thank you so much for joining this webinar. Any closing remarks, Mrs. Adeosi? Hello, Mrs. Biola. Any closing remarks, or Dr. Akiola?
Oh, thank you very much, Rosie. Sorry, I'm multitasking here. And I like the fact that you have announced the conference, and of course the fees are out. We started taking registration in earnest. Call for abstract is out, and we're getting ready assiduously for this international conference that promises to be a fantastic one. So thank you everyone for attending this. And we're going to have another one next month, I believe. We're having another webinar next month, right?
Yes.
Or is it in 2 weeks?
It's about 2 weeks or 3 weeks time. Sometime in April, but we will communicate the next
The date's out.
Yes.
Okay.
We'll
All right. So thank you. Thank you very much. Thank you all.
Yes, thank you so much for speaker, Mrs. Ejiroghene, for such a wonderful presentation. Thank you, everyone. Thank you.
Thank you.